No matter your skin tone, you are at risk for melanoma. So we wanted to find out if there are people who are at more risk than others. So Dr. Arthur Rhodes, who is the director of the Melanoma Surveillance Clinic at Rush University Medical Center, came in on his Father's Day to talk to us about this, because this is very important. But we do appreciate you taking this special day for you to come in and talk to us about this, because this is the time everybody's outside soaking in the sun. And I think this is an important subject matter, because those of us who have darker skin think we don't have to worry about it, but we're wrong, huh?
Yeah, if you've got dark skin and you think melanoma is only a problem of sun-seeking whites, that's a possible death sentence for you.
And are you seeing an increase in certain categories as a result?
Well, most melanomas are not related to the sun. About 10% are caused by the sun. And these are in heavily freckled, sun-damaged people.
Okay.
Most melanomas occur in relatively sun-protected sites. Palms of the hands, soles of the feet, the legs, the back.
Really?
It doesn't have to be in a sun-exposed site.
Okay.
We've had deaths related to that message that the sun causes melanoma.
Right. Okay, so then that brings me to, let's explain, what is melanoma then and what causes it?
Melanoma is a tumor of the cells in the skin called melanocytes. They're the cells that make pigment, and they're very necessary. And some people make a lot of pigment based on the enzyme in the cells. We all have the same number of melanocytes, but the enzyme differs according to ethnicity, skin color, race.
Mm-hmm. Okay, so if 10% of it is caused by sun, then the larger percentage, 90%, what can we do about that, and how does that happen?
Well, the question is, who's at risk for melanoma? Melanoma is about 15, 20 times higher in whites versus non-whites. But anybody can get melanoma in any part of the skin, or mucous membranes, or nail beds, palms, soles, the back, the buttocks, sun-protected as well as sun-exposed sites.
Okay, but it brings me back to you. If 90% of it is caused by something other related to the sun, then what can we do to prevent it? I'm putting on sunscreen when I'm going outside because I'm thinking I want to prevent melanoma, but I need to think about this a little more than I thought.
Sunscreens will not prevent melanoma.
Okay.
The one study that suggests that it might was a very flawed study. So sunscreens really don't prevent melanoma. They will prevent some of the other skin cancers, but not melanoma.
Okay.
I'm not convinced that staying out of the sun will prevent, but maybe a tiny, tiny fraction of melanomas.
Which I find fascinating to hear you say. But this time, let's clarify, though. You're not saying sunscreen's a waste of time.
Sunscreens prevent burning. And you want to prevent burning. That's just common sense. Clothing or sunscreens, avoiding heavy sun exposure, that's just common sense.
Okay, but what about, we've heard all our lives that if you get a severe sunburn, you are at higher risk for a type of skin cancer.
That's the least important risk factor for melanoma. It's about a twofold increased risk.
Okay.
And most of those studies, I think, are flawed because of something called recall bias. People who have melanoma compared to controls without melanoma. If you've got melanoma, you're looking for a cause, and you're going to remember your sun exposure habits compared to people who don't have melanoma and are asked the same questions.
So I got to ask you this again, then. What's the best prevention?
There is no way to prevent melanoma. The whole goal in melanoma is to pick it up early when it's curable.
Okay.
And that means looking at your skin, looking at the skin and like the scalp, the back, the buttocks of your loved ones, the hidden sites. There's no way to prevent melanoma, but picking it up early, it's a curable disease.
And that's interesting too, because you know, getting ourselves checked. We get annual checkups every year, but how many of us actually go for annual skin checkups? And that's very important. You
have to ask for a full head-to-toe exam with a full Monty. You know, Farrah Fawcett died of anal squamous cell cancer. Bob Marley's melanoma was on his big toenail. So melanoma in non-whites, half of them occur on the nails of the hands and feet, the palms, the soles, anus, genitalia, mucous membranes. Half. Totally sun-protected sites. About 10% in non-whites occur in these sites due to abnormal moles.
Okay, but doctor, how many people are actually getting that full scan?
You're going to have to ask for it.
Well, and I think that's something that people don't ask for, and I so appreciate you coming in this morning, because I think this is a real eye-opener for people to hear, and it's an important message. And we'd like to spend a lot more Father's Day with our families, so this is one thing that we should all be doing at least once a year, right?
At least once a year.
Yeah.
If you see something, say something on yourself or someone else. All melanomas present as a new mole or a changing mole. And if you see it on your loved ones, do something. Something that doesn't go back to normal within about 3 or 4 weeks. Most things that are new or changing are not melanomas, but something that doesn't reverse. If you're worried about it, get it checked by your general doctor first.
Wow, thank you so much for coming in. So great to meet you. Important information. Enjoy the rest of your Father's Day.
Anytime.
You can come back anytime.